moving over to video number 2, so I'm talking about the Panorama documentary, BBC, on ADHD private clinics exposed, and I'm talking about that. So I've just got up to the point where the journalist goes undercover as a patient at Harley Street Psychiatrists. So he pays Harley £685 for an assessment. That's a lot of money. He first of all has an online appointment. The assessor isn't a psychiatrist, despite the company's name. Olga Pakalek is a psychologist, and she asks him the following question. Some of the things she asked him included: do you recall being quite a disorganised child? So, for instance, having a messy bedroom. And then he tells her that his mum would definitely say yes. So she runs through a checklist of questions. Would you say that waiting was difficult, like when you'd have to wait in a queue? And then he says, maybe sometimes if the queue is really long. So he answers all of these questions honestly. This is, as to how he experienced life. And like I say, most people, vast majority of people, nearly every single person, will answer yes to some of these questions, some of the time. It doesn't mean the person has ADHD, necessarily. Would you say that you still become distracted or even just bored by things quite quickly? And he says, yeah, you can get bored by things, particularly mundane things. So those were some of the questions he was asked, but he wasn't given any detailed follow-up questions. Would you say that these days you could be quite loud-spoken? So he says not loud-spoken. He says he's changed that, but he says that if he's out and about, he could be loud-spoken. So she then says, but I'll put it down as a symptom, just because it requires effort. That kind of makes you think about how the same similar stuff can happen for autism as well, where like the whole masking excuse is used. Socialising doesn't seem to be a problem for you, but because it requires some effort, we'll class it as an autistic symptom, shall we? Could just be introversion, but yeah. Anyway, so he talks about how he's watched all the videos on social media, and at that point the meeting abruptly ends on Zoom, and then she randomly comes back. That's like a little bit weird, like she's suddenly there, and then she suddenly goes off the screen. It's like, okay. Then she comes back, and she tells him that she thinks he fits the criteria for ADHD. He will have it in writing as he has officially been diagnosed. So this was very much a tick box exercise. And that goes back to my point in another video, and I was talking about autism diagnoses, that it should never be a tick box exercise. Diagnosis is far more complex than a tick box exercise, because it's a case for all developmental conditions. A tick box exercise will by default throw up a lot of false positives, because nearly everyone in the general population will say yes to a significant number of those questions. It doesn't mean that they have a disorder. It's not just about having these traits, it's far more than that. So he says, yeah, the NHS one was thorough and rigorous. That's the NHS assessment that concluded he didn't have it, was a thorough and rigorous assessment. Now Casey, the patient I mentioned earlier, the young woman, she wanted to get her assessment done for the NHS, and she does get very emotional at this point when he tells her about Harley Street Psychiatrists and how they essentially fleece you of all that money, for such a short assessment. And she asks him, did I give you a diagnosis? And when he says yes, she says she's not surprised. She starts crying at that point, I think because she realises how fleeced she's been, and how if she'd gone for the NHS she would have actually got a proper thorough assessment. So emotional moment there from Casey. But she is now getting support for her mental health, it says. So to get a prescription, the journalist now needs to talk to the Harley psychiatrist. So he talks to the Harley psychiatrist. After just 3 minutes, the Harley psychiatrist is already suggesting ADHD drugs, Concerta XL, which is a powerful stimulant. But he is not told about the more serious side effects. He is not told that if he is started on medication, it can make other conditions worse. So he makes another appointment with a clinic called ADHD Direct in Glasgow, to see if this is happening elsewhere. Again, former staff say almost all patients get a positive diagnosis. He and his mum fill out questionnaires before the appointment. The NICE guidelines say assessment must be done by a psychiatrist or a suitably qualified clinician, but he is assessed by 2 nurses. The online assessment cost £1,095. He's asked more questions than Harley about his medical history, for example, health problems. And the appointment is longer, an hour and 40 minutes. And he's asked some of the following questions. Do you ever find yourself finishing off other people's sentences? Sometimes, he says. But again, he feels like it's a tick box exercise. He asks what he avoids at work. Would you avoid anything that is boring? For example. And there are little attempts to find out how seriously the symptoms affect his life. 3 weeks later, he gets another ADHD diagnosis, scores 8 symptoms for inattention and 6 symptoms for hyperactivity and impulsivity. So he meets the criteria for ADHD combined type, and he's advised to take stimulants. As part of the government's drive to cut waiting lists, the NHS are paying for thousands of people to be assessed in private clinics. A patient can request the NHS pays for them to go private if a waiting list is too long. For example, a clinic called ADHD 360 in Lincolnshire, a private clinic where NHS patients can be assessed. Appointments are short. He's told this by patients and former staff, and almost everyone gets a diagnosis. 6 patients per day. There are 6 patients per day, and they come on hour every hour. He's told this by a senior nurse practitioner. 6 patients per day, and they come on hour, and they come on the hour every hour. But he was told by ADHD 360 that it's only supposed to do 2 assessments a day. But he finds that what is happening in reality is quite the opposite. His online assessor is a pharmacist. It's an absolute joke. Pharmacist. And within a minute, she says she thinks he's probably got ADHD. Remember, by the way, he had a thorough NHS assessment which told him he didn't have it. And he obviously doesn't have it. He fills out a questionnaire beforehand, and he shows it is likely to have ADHD. The assessment lasts 75 minutes. The NICE guidelines say he should take a full psychiatric history, but this doesn't happen. He's prescribed medication and diagnosed yet again. He is told by ADHD 360 that it's regulated as an NHS provider, but it doesn't appear good practice at all. So that's basically the rundown. I did take very, very detailed notes. I pretty much wrote it all down, most of it, as you can tell. So for those who haven't had the luxury of watching it, I did basically take down pretty much all the main points. So that should give you a very thorough overview of what was talked about. Yeah, absolutely shocking, really. Let me know what you think in the comments box below. I have had a lot of personal scepticism about private practice for a long time. I don't think private practice is ever good, what I'm trying to say is, to put it this way, there are some good private practices out there, okay? We mustn't tar them all with the same brush. That would be wrong. There is good private practice out there. There are reputable private clinics. However, I do think it is a bit of a wild west out there. As much as there are good private clinics, there are also many very bad ones. And if you don't have the know-how, it can be very easy for someone to be fleeced and to not get a good assessment. The NHS obviously has standards, and generally you'd expect maybe a better service. However, it looks like the government is making cuts, and because of very long waiting lists now and lack of funding, even the NHS is kind of sullying itself, if you like, by using private practice. Private practice isn't the best, and patients might not have to pay if they go through the NHS, but I think that, well, it showed in his programme that this underhand practice is occurring on the NHS as well. So it's really not very good at all. Yeah, I'm not surprised, quite frankly, because I've had my doubts about what's been going on for a long time. And ADHD is underdiagnosed. There are lots of people who missed out on diagnosis growing up through school. The same for autism. There's a lot of people out there who genuinely have ADHD. It's a real condition. It's a very serious condition. Make no mistake. It's a very serious condition. Lots of people with it are on the streets. There are lots of homeless people with it. There are lots of people in prisons with it. It's a very serious condition. It's a disorder. It's a medical condition. It affects the brain. It's lifelong. It's serious. But it's one of these conditions that is unfortunately being overdiagnosed by people who are essentially normal but have some of the traits, because everyone has some of the traits, same with autism, but because clinicians are not doing it properly. It's not really any better than self-diagnosis, is it? Someone can come to a clinic, just list out all the symptoms and hey presto, get diagnosed. That's not good enough. They need to do a proper, thorough assessment. So let me know what you think, and thank you for watching.